As a cardiac nurse practitioner, I get a lot of consults and a lot of referrals from outside providers for abnormal EKGs. So I thought to myself, you know what? Let's make a lecture series about this and educate the people. So without further ado, from the creative mind of Make It Make Sense Cardiology, I bring you Abnormal EKG, Am I Dying or Not? An Andrea Gibson production. And on today's episode, we are going to talk about left and right axis deviation, and what in the dickens does that even mean? Students and new graduate nurses, grab something to write on. Nurse practitioner students and new graduate nurses, especially those of you who are going into like hospitalist medicine or family practice internal medicine. Oh yeah, you're going to want to keep this information to be able to explain to your patients what's going on when you get ready to refer them to me. The axis on the EKG, think of it like a compass. It is telling us what direction the electrical activity from the heart is going. Now, axis deviation just means that the electrical circuit is shifting just a little bit to the left if it's a left axis deviation, or it's shifting a little bit to the right if it's a right axis deviation. But your bigger question, clinicians, should be why? Why is this axis deviation showing up? And there's a number of different reasons why this possibility could be showing up on your patient's EKG, if it's actually legitimate. As always, my first piece of advice is if you get any sort of abnormal finding on your machine read of your EKG, take all them stickers off, take all those leads off, prep your patient's skin a little bit better, ensure that the electrodes are in the places where they are supposed to be, to include the limb leads, medical assistants, nurses, student nurses. Limb leads need to be on the actual limbs, not at the top of the shoulders, not on the sides of the abdomen. They are called limb leads for a reason, not just above the shoulder or just below the shoulder, close enough to the arm, so I'm gonna call it a limb lead. No. We put the limb leads on the actual limbs. That's my nugget for that. When you retake the EKG, if the EKG machine read still shows left or right axis deviation, all right, now clinicians, it's your turn. You have to have a conversation with your patient to see if any concerning symptoms are present. Chest pain, shortness of breath, dizzy spells, skipping, racing heartbeats, passing out episodes. Do you have any symptoms that can correlate with this finding? Because we don't just treat numbers, we don't just treat EKGs. You have to have both subjective and objective data in order to come up with a reliable or viable diagnosis for your patient. And you got to give cardiology something to work with, not for nothing. If you have, hypothetically speaking, you have right axis deviation plus concerning symptoms, it could mean that there is an underlying pulmonary issue, possibly COPD, possibly emphysema, possibly, and here's a big culprit, sleep apnea. The right side of the heart, student and new graduate nurses and NP students and NPs for that matter, we all know that it is the right side of the heart that is responsible for not just receiving blood flow from the body, but actually pushing that blood flow into the lungs. And if that pushing of blood flow is met with any resistance whatsoever, it is going to overwhelm the right side of the heart, causing it to stretch a little bit, the right side of the heart, and that will impair how the electrical signal can be pushed, it can impair how the electrical signal can travel, because the territory of the right ventricle is now shifted because it's stretched out. Right axis deviation. You could even have, in the inpatient setting, if you have a patient with right axis deviation with new onset shortness of breath, tachycardia, palpitations, might be a pulmonary embolism, but the bottom line is there could be some sort of underlying pulmonary culprit. Now let's look at the left side. Left axis, I'm getting excited. Calm down, Andrea. Left axis deviation, again, in the presence of symptoms, because context matters. Left axis deviation with symptoms could mean that there is a concern for impaired coronary blood flow. Could mean. How do we evaluate further this left axis deviation or right axis deviation with symptoms to see if there's anything troubling or the matter with the heart itself? We do an echocardiogram. Echocardiogram is always going to be the go-to when it comes to further evaluating EKGs that are abnormal in any capacity whatsoever. The EKG tells us what the heart is doing electrically on paper. The echocardiogram gives us actual eyes on the heart to see what the heart's chamber dimensions are, to see how well the heart squeezes and relaxes, to see the musculature of the heart, and of course the valvular integrity on the inside. So wrapping things up, left or right axis deviation by itself in the absence of symptoms means you need to repeat this EKG. You need to repeat this EKG first and foremost to see if this is a true result or if this is just user error. If you still have right or left axis deviation in the absence of symptoms, there might be an electrical conduction problem. It might be, but the only way to know is to follow up with cardiology. Thank you very much for the referrals. Left or right axis deviation with symptoms. Now you got a picture that's being painted clinically that deserves further investigation. Maybe an underlying lung issue when it comes to right axis deviation, maybe an underlying coronary artery blockage issue when it comes to left axis deviation. Does that clear things up? I told y'all gonna want this information. You have loads of content creators that are teaching you about dysrhythmias and interpretations therein, and I am one of those also. But who is teaching you this good stuff? The abnormal EKGs that they don't cover in nursing school, and they definitely don't cover this in NP school. Your girl is teaching you that. Follow along. Got lots more of this to come from. You want to learn about LVH criteria, poor R wave progression, non-specific T wave abnormalities, early repolarization, got all those dropped also, and plenty more to come. Make it make sense cardiology. And by the way, grab it. Big, selling like hotcakes. Grab it. Link is in the bio, also available on Amazon. Until next time, class is dismissed.